Ever wondered what surgery was like before painkillers? Before someone smart finally said, hey, maybe we should knock people out before cutting them open? Well, medieval surgery was basically a horror show where staying alive was considered a five-star review. Back in medieval times, surgery wasn't just a medical procedure. It was basically the hottest ticket in town. People would actually line up to watch someone get their leg chopped off or a tumor removed. I guess when you don't have Netflix, you take what entertainment you can get. Medieval surgery was about as pleasant as getting hit by a horse-drawn carriage. Twice. These doctors had absolutely no clue about basic things we take for granted today. They didn't know about nerve endings, which meant they couldn't figure out why people kept screaming when they stuck knives into them. Shocking, right? And don't even get me started on hygiene. Their idea of sterilizing equipment was giving it a quick wipe on their probably not-so-clean shirt. Here's a fact that'll make you appreciate modern medicine. Around 80% of medieval surgery patients died not from the actual surgery, but from the infections that followed. These surgeons would operate with the same unwashed tools they'd used on their last 10 patients, wearing clothes that hadn't seen soap since the last crusade. It's like they were running a buy one surgery, get one infection-free special. But some medieval surgeons were actually celebrities. I'm not kidding, people would travel for days just to get cut open by a specific famous surgeon. It's like medieval influencer culture, except instead of promoting beauty products, these guys were promoting their ability to saw off your leg in under a minute. Some patients would literally pay extra to get operated on by a particular surgeon, even though their chances of survival were about the same as winning a sword fight against a dragon. And speaking of survival, you'd think these medieval doctors would at least try to make things less painful for their patients. Well, they did try, sort of. Some of their attempts at pain relief were so bizarre you'd think they were making it up as they went along. Like that time they figured out that freezing someone half to death might actually help with the pain. They discovered that extreme cold could actually help with pain, though calling it a discovery might be giving them too much credit. It was more like, hey, this soldier who's been lying in the snow for 6 hours isn't screaming as much when we cut his leg off. The whole thing started with battlefield surgeons who had no choice but to operate in terrible conditions. Picture this poor doctor, probably wearing 6 layers of wool because medieval fashion was all about that layered look, trying to save soldiers in the middle of winter. They started noticing something weird. The soldiers who'd been lying in the snow for hours were much easier to operate on. Not because they were braver or tougher, but because their limbs were basically frozen solid. Fun fact, records from the 13th century show that one particularly clever surgeon named Heinrich von Freund actually wrote about packing wounds with snow before operations. He was basically the medieval version of an ice pack enthusiast. Got a broken arm? Put some snow on it. Getting your foot chopped off? More snow? Wife complaining about your surgical obsession? You guessed it, snow. But here's where things get really interesting. These medieval doctors had absolutely no idea how long they could leave someone's body parts in the ice or snow. They were basically playing a very dangerous game of frozen limb roulette. Too little time in the cold and the patient would feel everything. Too much time and suddenly you're dealing with frostbite on top of everything else. There's this hilarious account from a 14th century monastery where a monk surgeon tried to numb a patient's arm by burying it in snow for an entire night before surgery. The good news? The patient didn't feel any pain during the operation. The bad news? That's because the arm was completely frozen and had to be amputated anyway. Talk about solving one problem by creating an even bigger one. Some surgeons got really creative with their cold therapy. They'd make ice packs out of whatever they could find: snow, crushed ice, or even cold river stones. One particularly resourceful doctor in northern France became famous for his special numbing technique, which basically involved making his patients stand waist deep in a freezing river before surgery. His success rate wasn't great, but at least his patients were very well preserved. According to records from his monastery, he lost more patients to pneumonia than to actual surgical complications, a distinction he was oddly proud of. The really ambitious surgeons tried to combine cold therapy with other pain relief methods. My personal favorite is the story of a German surgeon who would first make his patients sit in the snow, then give them strong ale to drink. His theory was that the cold would numb their bodies while the ale would numb their minds. Surprisingly, this wasn't the worst idea they came up with, though it did lead to a lot of drunk, frozen patients who couldn't feel their toes but were somehow still conscious enough to complain about it. The most entertaining and slightly terrifying records come from a Norwegian surgeon who specialized in what he called winter operations. He would only perform surgeries on the coldest days of the year, making his patients lie in snowbanks until their teeth stopped chattering. According to his notes, this was because a patient who can't feel their own face probably won't feel the knife either. Medieval medical logic at its finest. He even developed a reputation for being the ice doctor and would refuse to operate unless the temperature was below freezing. Patients would actually wait months for winter just to see him, which says a lot about medieval healthcare options. The real problem wasn't just the cold itself, it was the medieval doctors' complete lack of understanding about how the human body works. They had no idea about circulation, frostbite, or why turning someone into a human popsicle might not be the best medical practice. Some actually believed that if a limb was cold enough, it would just naturally fall off, saving them the trouble of amputation. Spoiler alert, that's not how it works. One particularly misguided surgeon wrote that the colder the limb, the cleaner it separates, as if human bodies worked like frozen chicken wings. There were always those patients who just couldn't handle the cold treatment. They'd start jumping around, trying to warm themselves up, which kind of defeated the whole purpose. This led some surgeons to try a different approach, one that involved a bit more force and a lot less finesse. When freezing a patient wasn't an option, medieval doctors turned to what I like to call the bite down and pray method. It was exactly as sophisticated as it sounds. Patients were given something to bite on, usually a piece of wood, leather, or rope, and told to hang on for dear life. It was basically the medieval version of take 2 aspirin and call me in the morning. Except instead of aspirin, you got a stick, and instead of calling in the morning, you might not make it to morning. The choice of what to bite down on was actually pretty important. Rich patients got fancy leather straps, sometimes even decorated with gold thread, because nothing says I'm wealthy quite like a designer mouthguard while you're getting your legs sawn off. Poor folks had to make do with whatever was lying around. There are actual records of surgeons grabbing branches from nearby trees or ripping strips off their own belts when they forgot to bring proper biting materials. One surgeon even became famous for his emergency kit, which was just a collection of different sized sticks he gathered from his garden. Here's a statistic that'll make your dentist cringe. About 60% of surgery patients who used the bite-down method ended up with broken teeth. Turns out, when you're experiencing the worst pain of your life, you tend to bite down pretty hard. Medieval dentists actually made a decent living just fixing the teeth that got shattered during surgeries. It was like a 2-for-1 deal. Get your tumor removed, get some dental work done, whether you wanted it or not. Some clever dentists even started hanging around outside surgery rooms, drumming up business from the waiting family members. Some surgeons got creative with their bite-down devices. One French doctor became famous for his special comfort rope, which was just regular rope that he'd soaked in wine. His patients probably didn't feel any less pain, but at least they got a nice buzz from sucking on wine-soaked rope while being operated on. Another surgeon in Germany carved little handles into his wooden bite sticks like some sort of medieval stress ball for your mouth. He even started taking custom orders, adding decorative carvings for his wealthier patients, medieval medicine's first attempt at luxury branding. But the real innovation in medieval pain management came from what I call the knockout artists. These were surgeons who figured out that an unconscious patient was a quiet patient. Their method was simple. Punch the patient in the head hard enough to knock them out. That's it. That was the whole technique. No complicated medications, no careful calculations, just good old-fashioned blunt force trauma. One medical manuscript from 1382 actually lists strong right hook as an essential surgical skill. The medical records from this period are unintentionally hilarious. One surgeon actually wrote in his journal, "Patient proved difficult to quiet, solved the problem with swift application of fist to temple." Another noted, 3 attempts required for sufficient quieting, must work on improving aim. These guys were basically treating surgery like a boxing match where only one person was allowed to throw punches. Some even developed their own signature moves like the Southampton silencer or the Norwich nap time tap. The strength of the surgeon became weirdly important. Some hospitals actually hired what they called quieting assistants. Basically, big, strong guys whose only job was to knock patients unconscious. It's probably the only time in medical history where "how hard can you punch" was a legitimate job interview question. One famous surgeon in England was known for his gentle hands during surgery, but mighty fist before it. Talk about a weird job recommendation. There's even a record of a monastery that specifically recruited former blacksmiths as surgical assistants because of their reliable knockout capabilities. Of course, this method had its problems. Sometimes patients were knocked out for way longer than intended. Others woke up in the middle of surgery, which was bad news for everyone involved. There are records of one particularly unfortunate case where a patient woke up, panicked, and headbutted the surgeon, leading to both of them needing medical attention. It was probably the first and only time in history where a patient and doctor simultaneously knocked each other out. The hospital's solution? They started requiring surgeons to wear helmets during operations. Safety first, medieval style. The worst part is that some surgeons actually believed that the harder you hit someone, the less pain they'd feel during surgery. This led to what one medieval medical text delicately called excessive quieting, which is a fancy way of saying they sometimes hit people so hard they caused serious damage. One surgeon proudly recorded that none of his patients ever complained during surgery, though he failed to mention it was because most of them had concussions. Another wrote a whole treatise on the perfect quieting force, basically a medieval dissertation on how to punch people unconscious without accidentally killing them. By the late medieval period, some doctors started questioning whether punching patients was really the best approach to surgery. A few even suggested that maybe, just maybe, there might be better ways to handle pain than assault. This radical thinking led some surgeons to experiment with a new pain management technique, getting their patients completely drunk. After all, if you can't freeze them or punch them, you might as well help them drink their troubles away. Medieval surgeons loved alcohol almost as much as they loved their saws and knives. The rule was simple. The more serious the surgery, the more booze you needed. Getting a tooth pulled? That's a pint of ale. Losing a leg? Better finish the whole barrel. Records from a London hospital in 1340 show they spent more money on wine for patients than on actual medical supplies. That's right, their alcohol budget was bigger than their bandage budget. One surgeon even wrote that his hospital went through about 50 barrels of wine a month just for pre-surgery treatment. And this wasn't your fancy modern wine. We're talking about the strong stuff that could probably strip paint off walls. A monastery record shows they actually used the same wine for surgeries and cleaning their floors. Talk about multi-purpose medicine. The patients weren't the only ones drinking, though. Most surgeons operated while completely hammered. They claimed it helped steady their hands, which makes about as much sense as saying a blindfold helps you see better. There's this fantastic complaint letter from 1387 where a patient writes, "The surgeon was so drunk, he tried to amputate my left leg 3 times before someone told him it was my right leg that needed removing." Talk about being bad at following directions. Another surgeon became famous for singing drinking songs while operating. His patients reportedly begged him to stick to humming. Here's the medieval surgical prep list I found. 1 saw, 2 knives, 3 barrels of wine. At least they were prepared, right? Some surgeons even had their own special pre-surgery drinking rituals. One guy would only operate after drinking exactly 7 cups of ale. Not 6, not 8, but 7. He probably spent more time counting his drinks than checking his patients. Another insisted on drinking from a lucky copper cup that he claimed improved his surgical skills. Spoiler alert, it didn't. But they completely missed how alcohol actually works. These medieval doctors thought drinking would dull the pain, but anyone who's ever stubbed their toe while drunk knows that's not true. Alcohol thins your blood, which means their drunk patients were basically human fountains during surgery. The medieval operating room was like a really weird tavern. You had drunk doctors, drunk patients, and probably drunk spectators because surgery was entertainment back then, remember? Sometimes they'd even have drinking games going on during the operation. There's a record of one surgeon who would take a shot every time his patient screamed. Needless to say, he didn't have a very high success rate. Another hospital had what they called a courage corner, where nervous patients could drink themselves brave before surgery. Some hospitals tried to create recommended drinking guidelines for surgery. These are hilarious to read now. One suggested that tall patients should drink more because the wine needs to reach further. Another recommended different types of alcohol for different surgeries. Beer for minor cuts, wine for broken bones, and strong spirits for amputations. It was like a medieval cocktail menu, but with more screaming. One particularly detailed guide even specified that red-haired patients should drink more because they were naturally more resistant to wine's effects. Medieval medical science at its finest. The wealthy patients got the good stuff, obviously. Poor folks had to make do with whatever cheap ale they could afford. One surgeon actually kept a chart showing what kind of alcohol went with what social class. It read something like nobles, finest French wine, merchants, local wine, peasants, whatever's left in the barrel from last week. Medieval healthcare at its finest. Some rich patients even brought their own wine to surgery, treating it like some sort of BYOB party from hell. But the absolute best part was their solution when someone had too much to drink before surgery. Instead of waiting for them to sober up, they just give them more alcohol. Their logic was that if you're already drunk, you might as well be drunk enough to pass out. There's a case from 1392 where a patient was so drunk before his surgery that he tried to perform it himself. The surgeon's solution? Give him more wine until he can't hold the knife anymore. As more patients started dying from blood loss, some doctors began experimenting with alternatives. They started looking into various herbs and plants that might knock people out without turning them into walking wine barrels. Of course, these experiments came with their own set of problems, like figuring out which plants would make you sleep and which ones would make you sleep forever. These weren't your garden variety plants. We're talking about some seriously potent stuff. Mandrake root, henbane, opium, and nightshade made up their go to sleep or else collection. It was basically a medieval chemistry experiment where the test subjects were very unlucky patients. Getting the dosage right was like trying to juggle flaming torches while riding a horse backward. Technically possible, but probably going to end badly. According to one medical text from 1356, about 1 in 3 patients given these herbal concoctions either stayed awake and felt everything or went to sleep and never woke up. Those aren't exactly the kind of odds you want to hear before surgery. The scariest part? Some doctors actually bragged about these numbers, claiming they were better than the competition's survival rates. The sleep sponge was their finest invention. Take a regular sponge, soak it in a mixture of opium, mandrake juice, and whatever other questionable plants you could find, then shove it in the patient's face until they pass out. One surgeon wrote proudly about his special recipe that included 17 secret herbs, making him basically the medieval Colonel Sanders of knockout drugs. The only difference, his secret recipe had a much higher death rate. He even tried to franchise his method to other hospitals, but most of them passed when they realized how many patients weren't waking up. Some doctors got really creative with their herb combinations. There's a record of a surgeon who mixed his herbs based on the patient's zodiac sign. If you were a Taurus, you got extra mandrake because apparently bulls needed stronger sedatives. Geminis got a double dose because 2 personalities need twice the herbs. This guy probably should have spent less time studying the stars and more time studying medicine. He kept detailed records of which star signs survived best. Spoiler alert, being an Aries didn't improve your chances. Here's the statistics for you. In one medieval hospital, they went through enough opium in a year to knock out a small army. Literally, they actually had to stop treating soldiers because they ran out of drugs. The hospital's record keeper noted, "Use the last of the sleeping herbs on Baker with a toothache. Must turn away knights with arrows in their chest." Poor planning. They eventually started growing their own herbs in the hospital garden, which led to some interesting situations when local kids kept trying to steal their medical plants. The rich patients, as usual, got the premium stuff. They had their own artisanal herb mixtures, carefully measured and mixed with expensive spices to mask the taste. Poor folks got what one honest surgeon called whatever weeds we found growing behind the hospital. Sometimes these weeds worked better than the fancy mixtures, which probably says more about medieval medicine than anything else. One nobleman actually demanded his herbs be mixed with gold dust, thinking it would make them more effective. Spoiler, it didn't help, but at least he was unconscious in style. Hallucinations were a common side effect. Patients would wake up claiming they'd seen angels, demons, or their dead relatives playing cards. One guy was convinced he'd spent his entire surgery having tea with the King of France. The surgeons usually just nodded along. After all, it was better than having patients wake up screaming about the actual surgery. Some doctors even started keeping track of the most interesting hallucinations, turning their medical records into something more like a dream journal. The funniest reports come from a hospital in Germany where they tried to standardize their herbal mixtures. They created what they called sleep grades, ranging from gentle nap to probably still breathing. The middle grade was labeled talkative but won't remember, which apparently meant patients would babble nonsense throughout the entire operation. One surgeon kept a journal of his favorite patient ramblings, including a merchant who spent his entire surgery trying to sell imaginary geese to the ceiling. Another patient apparently gave a 3-hour lecture on proper turnip farming while having his leg amputated. But it's worse when some of these herbs were so strong that not only did they knock out the patients, but they also affected anyone standing too close. There are multiple accounts of assistants passing out during surgery because they got too close to the sleep sponge. One hospital had to start tying their surgeons to poles to keep them upright. Medieval workplace safety at its finest. They even developed a rotation system where they'd switch out assistants every few minutes to prevent the whole surgical team from collapsing. The really desperate patients would sometimes try to get their hands on these herbs before surgery and take extra, thinking more was better. This rarely ended well. A record from 1375 describes a man who stole an entire bag of sleep herbs the night before his surgery. Patient arrived unconscious, saved us the trouble of knocking him out. Unfortunately, it also turned blue. Had to postpone surgery to figure out if I was still alive. Another patient ate so many mandrake roots that he slept through his own surgery, the recovery, and his neighbor's funeral 3 days later. As surgeons started running out of patients, with patients either dying from herbs or staying annoyingly conscious through operations, they began focusing on a different approach. If you couldn't properly knock them out, maybe you could at least do the surgery really, really fast. The fastest surgeons were like medieval rock stars. They had groupies, fan clubs, and probably would have had their own reality TV shows if television had existed back then. These guys weren't just doctors, they were the Formula One drivers of the operating room, complete with their own highlight reels in medical textbooks. Robert Liston was the champion of speed surgery. This Scottish surgeon would remove a leg in 28 seconds flat. That's less time than it takes to microwave a hot pocket. He was so quick that his assistant couldn't keep up with him, which turned out to be a problem when Liston accidentally cut off 3 of the poor guy's fingers during a particularly speedy amputation. But wait, it gets better. He was moving so fast that he also managed to slash a spectator's coat. The assistant and the spectator both died from infections later, making this probably the only surgery in history with a 300% mortality rate. The patient died too, but at least he died quickly. Speed records became a big deal. Hospitals actually kept track of their surgeons' best times like they were running some kind of twisted sports league. And in today's standings, Dr. William takes the lead with a 45-second leg removal, while Dr. James drops to second place after spending an embarrassing full minute on a simple arm amputation. The competition was so fierce that some surgeons hired people to time their operations with hourglasses. One hospital even installed a giant clock in their operating theater, though they had to remove it after surgeons kept getting distracted trying to beat their personal records. The average amputation in a London hospital in 1840 took about 2 to 3 minutes, but some hotshot surgeons claimed they could do it in under 30 seconds. One French surgeon even advertised guaranteed amputation in 25 seconds or your money back. Though honestly, if you died from blood loss, getting your money back probably wasn't your biggest concern. Another surgeon offered a buy one, get one free deal on quick amputations, which seems like a terrible marketing strategy for a doctor. These speed demons didn't just use saws, sometimes they went for the chisel and hammer approach. That's right, they'd literally smash through the bone like they were doing home renovations. One surgeon's toolkit included a hammer he'd borrowed from his local blacksmith. Patients would wake up to find their legs gone and what looked like carpentry tools covered in blood next to them. Talk about a DIY nightmare. Some surgeons even started rating their patients' bones on a hardness scale to brag about how quickly they could chisel through them. The operating theaters became like medieval sports arenas. People would place bets on how fast the surgeon could finish. 10 shillings says he does it in under a minute. 20 says the patient passes out before the leg comes off. Some surgeons even developed signature moves like Liston's famous flourish, where he'd hold up the amputated limb like a trophy while the audience cheered. It was basically the medieval equivalent of a touchdown dance. There's even a record of one surgeon who hired a town crier to announce his operation times in the town square. But speed had its downsides. About 1 in 4 patients died, not from the surgery itself, but because the surgeon was in such a hurry that they sewed everything up with bits still inside. One doctor found a whole saw blade that another surgeon had accidentally left in a patient's leg. The patient had been complaining about a scratching sensation when walking. No kidding. Another surgeon was so focused on speed that he amputated the wrong leg, realized his mistake, and then had to do the other one too, probably setting some kind of record for most unnecessary amputations in one session. Some surgeons started training like athletes. They'd practice their sawing technique on wooden logs, trying to beat their personal best times. One guy got so into it that he'd carry his saw everywhere, whipping it out at dinner parties to show off his cutting speed on the furniture. His wife apparently banned him from buying new tables after he ruined their 3rd dining set. Another surgeon built a practice dummy filled with pig bones to keep his skill sharp. His neighbors complained about the noise, but admitted his technique was improving. Fast surgeons became so popular that they started getting special requests. "Could you remove my uncle's leg before his soup gets cold? I need this done before the church bells ring." One surgeon actually advertised operations performed between prayers. You won't miss a single hymn. Talk about efficient religious time management. Some patients even started requesting specific speeds, like they were ordering their steak done rare or well done. But the absolute best development was the emergence of surgical showmen. These guys would dress up in special outfits, complete with decorated saws and custom-made blood-proof aprons. They'd put on a whole show, complete with pre-surgery speeches and post-operation victory laps around the operating theater. One surgeon even hired a band to play dramatic music during his operations, though they kept getting splattered with blood and had to stop. Another had an assistant whose only job was to polish his saw between cuts to make sure it gleamed dramatically in the candlelight. While all this speed surgery madness was going on, some of the more sensible doctors started thinking about a different approach. Maybe instead of racing through the operation, they could try controlling the bleeding better. That's when someone came up with a brilliant idea involving ropes and knots. The tourniquet trick, they called it, though trick makes it sound way more fun than it actually was. Medieval doctors figured out that if you squeeze a limb hard enough with a rope or belt, it would cut off blood flow and reduce pain. It was like their version of a magic trick, except instead of pulling a rabbit out of a hat, they were trying to stop their patients from bleeding to death. The first tourniquets were pretty basic, just a piece of rope or a leather strap wrapped around the limb. But some doctors got fancy with it. One guy invented what he called the perfect pressure device, which was just a stick tied to a rope that he would twist until the blood flow stopped. He was super proud of this invention, even though it was basically the same thing as wringing out wet laundry, but with human limbs. He even tried to patent it, but the medieval patent office rejected his application because, well, it was just a stick tied to a rope. Here's a wild statistic for you. Records from one military hospital show they used up about 200 feet of rope per month just on tourniquets. That's longer than a medieval castle. They went through so much rope that local merchants started selling special surgical rope at triple the normal price. It was the exact same rope they sold to farmers, just with a fancier name and a much bigger price tag. One merchant even started dyeing the rope different colors and claiming certain colors worked better for different types of surgeries. The timing was crucial. Leave the tourniquet on too long and the tissue would die. Leave it too loose and it wouldn't work at all. Some surgeons actually used hourglasses to time how long they left the tourniquet on, which led to some interesting situations. There's a record of one doctor who got so focused on his hourglass that he forgot about the actual surgery. His patient survived, though, so maybe he was onto something. Another surgeon tried using multiple hourglasses for different parts of the body, but got them mixed up and created what his colleagues called the patchwork patient. But it's really interesting, some medieval doctors actually believed pain was good for healing. They thought that if you weren't suffering, you weren't getting better. These guys would deliberately leave the tourniquet loose enough so patients could still feel everything. One surgeon wrote in his diary, "Patient complained about pain during surgery. Excellent. Should heal perfectly." Medieval medical logic at its finest. Some even had a pain scale based on how loudly their patients screamed. The wealthy patients got special treatment, of course. Instead of regular rope, they got silk tourniquets, sometimes even decorated with gold thread. Because nothing says, "I'm rich," quite like having a fancy rope cutting off your blood circulation. One nobleman apparently requested his tourniquet be made from the same silk as his favorite doublet. Talk about matching your medical equipment to your outfit. Another rich patient insisted on having his tourniquets perfumed because he couldn't stand the smell of regular rope, as if that was going to be his biggest problem during surgery. Some surgeons developed their own special tourniquet techniques. There was this one guy who claimed he could tell exactly how tight to make the tourniquet just by looking at the patient's face. His secret? He'd keep tightening it until they passed out. Not exactly scientific, but at least his patients weren't awake to complain. He even wrote a guide called The Art of the Perfect Squeeze, which probably wouldn't pass modern medical peer review. The best part was the assistant problem. Keeping constant pressure on a tourniquet was hard work, so surgeons would often assign this job to their assistants. These poor folks would have to stand there for hours, maintaining the exact same pressure. One hospital record mentions an assistant who got so tired during a long surgery that he fell asleep standing up, still holding the tourniquet. The patient survived, but the assistant got a nasty bump on his head. After that, some hospitals started using a buddy system for tourniquet duty. One assistant to hold the tourniquet, another to hold up the first assistant. Training new surgeons to use tourniquets properly was its own adventure. They'd practice on each other, which led to some pretty entertaining situations. One medical school had to create a rule that students weren't allowed to practice tourniquets before important exams because too many of them were showing up with numb limbs and failing their tests. There's even a record of a student who got so good at applying tourniquets that he started offering his services at parties. Medieval medical students had weird hobbies. The really dedicated doctors would carry their special tourniquet equipment everywhere. One surgeon had a custom-made belt that could double as a tourniquet in emergencies. He was very proud of this until he actually tried to use his own belt during an emergency surgery and his pants fell down in front of the entire operating theater. After that embarrassing incident, he invented what he called the emergency backup belt, which was just another belt. Revolutionary stuff. As hospitals filled up with patients suffering from gangrene because their tourniquets had been left on too long, doctors started looking for ways to make surgeries less painful without cutting off circulation entirely. That's when they came up with another brilliant idea. Maybe if they couldn't see the patient screaming, it would be easier to operate, and thus began the era of the screaming rooms. Well, medieval surgery patients were the original noisy neighbors from hell. Hospitals actually had special screaming rooms set aside for surgeries, basically soundproof chambers where patients could yell their lungs out without disturbing everyone else. It was like a medieval recording studio, except instead of making music, people were making sounds that would give you nightmares. A hospital record from 1362 shows they spent more money soundproofing their surgery rooms than they did on actual medical equipment. They stuffed the walls with wool, hay, and whatever else they could find to muffle the screams. One hospital even hired a professional wall stuffer who normally worked in castles. His job title? Master of Quieting. Probably the weirdest job title in medieval history. His resume must have been interesting. Professional experience includes making sure the king can't hear peasants complaining and stopping surgery patients from terrifying the entire town. Music became a big thing in operating rooms. If you couldn't stop the screaming, you could at least try to drown it out. Rich patients got entire bands playing during their surgeries. Poor folks had to make do with a guy banging on a drum badly. One surgeon hired a group of monks to chant during operations because he thought it made him look more professional. The monks quit after a week because they couldn't chant loud enough to cover the screaming. He then tried hiring a group of town drunks instead, figuring their loud singing would do the trick. Surprisingly, this worked better than the monks. The really fancy hospitals had different music for different surgeries. Leg amputation? That's a full orchestra. Tooth pulling? Just a guy with a flute. One hospital actually had a price list. Basic surgery, 1 drummer. Complex surgery, 3 musicians. Royal surgery, entire choir plus bells. Because nothing says high-class medical care quite like having a full choir watching your surgery. They even had special songs composed for different procedures. The amputation allegro was particularly popular. Some surgeons took the whole distraction thing to weird levels. Records show one doctor who would make animal noises during operations. He thought it would confuse patients so much they'd forget about the pain. Patients seemed less concerned with amputation once the doctor started mooing like a cow. reads one report. Another surgeon trained his whole staff to bark like dogs during particularly painful procedures. Medieval hospitals must have sounded like very noisy, very disturbing farms. One doctor even specialized in chicken impressions, claiming that nobody could scream while trying to figure out why their surgeon was clucking. The statistics are hilarious. One hospital reported using up to 50 sets of drumsticks per month because their drummers kept breaking them trying to play louder than the patient's screams. Another spent more on musician fees than on bandages. A London hospital in 1375 actually had more musicians on staff than doctors. Their reasoning? Music is cheaper than medicine, and patients complain less when they can't hear themselves scream. They even had a musician on call schedule, just like doctors have today. But not all sound masking attempts worked out great. One surgeon tried using bells to drown out the noise, but the constant ringing drove his assistants crazy. They started showing up to work wearing wool in their ears, which meant they couldn't hear his instructions either. After 3 botched surgeries where the assistant couldn't hear which leg to hold down, they switched back to drums. The bells got recycled into what they called a patient alert system, basically an early medieval version of a hospital PA system. The award for worst idea goes to the hospital that tried to use the town crier to outshout their patients. They stationed him outside the surgery room with instructions to yell news and announcements whenever someone started screaming. This worked fine until he started announcing details of the actual surgeries. Hear ye, Dr. John is currently removing Thomas the baker's leg. There's a lot of blood. They had to fire him when he started giving play-by-play commentary on particularly interesting operations. Some patients developed quite a reputation for their screaming abilities. One guy's yells were so impressive that people would gather outside the hospital just to listen. The surgeon actually started charging admission. Medieval entertainment was weird. Another patient screamed so loud during his surgery that the local church thought it was hearing banshees and organized an exorcism. The priest who showed up took one look inside the surgery room and decided the demons probably had a good reason for screaming. Though dealing with screaming patients was tough, the real problem started when hospitals tried different ways to keep their patients quiet. Staff would try all sorts of things, telling jokes, making faces, even promising prizes for staying quiet. One doctor became famous for his surgical stand-up routine where he'd tell terrible jokes during operations. His patients still screamed, but now it might have been from the bad puns rather than the pain. Why did the leg cross the road? Because I just amputated it, was apparently one of his favorites. As medieval doctors ran out of ideas for handling noisy patients, some started exploring a new direction, trying to distract patients with increasingly bizarre methods. After all, if you can't shut them up, maybe you could at least get them to focus on something other than the saw going through their leg. Medieval surgeons were basically the world's worst party planners, always trying to find new ways to keep their patients entertained during operations. Their distraction tactics ranged from mildly clever to absolutely bonkers. Take Dr. William of York, who spent more time practicing his jokes than his actual surgical skills. His most famous line, "What's the difference between a successful surgery and a failed one? About 6 feet." The patients didn't laugh, but the gravediggers sure did. He kept a journal of all his surgical jokes, probably the only medical text in history that was actually meant to be funny. Some surgeons tried the conversation route, chatting about anything and everything while they worked. According to hospital records from 1368, one doctor would ask patients about their family trees during surgery. By the time he finished an amputation, he'd know your entire family history back to your great-great-grandmother's pet goat. He actually kept all these family records and became the town's unofficial genealogist. People would come to him for both surgery and family research. Talk about a side hustle. He even started charging extra for premium family history packages during longer operations. The slapping technique was particularly popular among less creative doctors. Their theory was simple. If you slap a patient's face, they'll focus on that pain instead of the surgery. One surgeon became known as the Slapper of Surrey because he'd give his patients a quick smack every time they started screaming. His success rate wasn't great, but his hand-eye coordination was amazing. Records show he could slap a patient and saw through a bone at the same time, a skill that absolutely nobody needed. He even trained his apprentices in the art of therapeutic slapping, which had to be the weirdest medical training ever recorded. A hospital in France hired professional storytellers to work during surgeries. These weren't just any stories. They were specifically chosen to be as inappropriate as possible. The theory was that if you tell someone a dirty joke while cutting off their leg, they'll be too embarrassed to scream. One particularly famous storyteller, Gene the Questionable, had a collection of tales so scandalous that several patients reportedly forgot they were being operated on because they were too busy blushing. The hospital actually had to create a special position called Master of Inappropriate Tales, probably the only job title in history that got better if you were worse at being proper. In one medieval hospital, 30% of their operating budget went to what they called distraction supplies. This included everything from juggling balls to live chickens. They had a resident juggler on staff who doubled as a nurse. Unfortunately, he kept dropping things during surgery, which probably wasn't great for patient confidence. Don't worry, he only drops the juggling balls, not the surgical tools, usually. The hospital's annual budget listed emergency juggling equipment as a major expense, right next to bandages and saw sharpening. The most ambitious surgeon was probably Dr. Henry of Bath, who tried to set up what he called a complete sensory experience. He'd have someone playing music, another person waving fragrant herbs around, someone else telling jokes, and a fourth person showing the patient various interesting objects. The result? Total chaos. His operating room looked like a medieval circus gone wrong. One patient described it as being murdered in the middle of a festival. Dr. Henry eventually scaled back his entertainment plans after several of his assistants quit, claiming they'd rather work in an actual circus. Some doctors took the psychological approach. They'd make the surgery sound so boring that patients would almost fall asleep from disinterest. One surgeon would describe the technical details of his tools in excruciating detail. This saw was forged by Thomas the blacksmith on a Tuesday afternoon using iron from the mines near Winchester. By the time he got to the actual surgery, most patients were either asleep or begging him to just cut them already to stop the lecture. He wrote a book called The Complete History of Surgical Tools that was so boring it was actually prescribed as a sleeping aid. The prize for most creative distraction goes to a London surgeon who hired a professional mime to work during surgeries. Yes, a mime. In an operating room, during amputations. The mime would act out what was happening, but in a funny way. Patients reportedly didn't know whether to scream from pain or laugh at the mime pretending to saw off his own leg. The mime quit after a month, claiming the job was too weird, and when a medieval mime says something's too weird, you know it's bad. The hospital tried to replace him with a juggling jester, but that ended badly when the jester's bells kept getting caught in the surgical equipment. But perhaps the strangest distraction method was the future prediction technique. During surgery, doctors would pretend to read their patients' palms and make up elaborate predictions about their future. I see you living a long life with 2 legs instead of 3. It was complete nonsense, but it kept patients focused on their supposed future rather than their current dismemberment. One surgeon got so into it that he actually became a legitimate fortune teller after retiring from surgery, probably because predicting the future was easier than keeping patients alive. All these bizarre distraction methods started making hospitals look more like entertainment venues than medical facilities. Some doctors began wondering if maybe they were focusing too much on the show and not enough on the actual medicine. When one surgeon caught his assistant practicing juggling instead of sterilizing instruments, not that they really knew what sterilizing was, he knew things had gone too far. Maybe it was time to try something simpler, like better surgical techniques. Medieval surgeons weren't born experts at chopping off limbs, so how did they get so good at it? Let's just say their practice methods were the stuff of nightmares.